Hey guys, welcome to my very first Facebook live chat. I'm so excited. Well, first of all, this live chat is sponsored by L'Oreal, to say that off the bat, but I have one of the best dermatologists ever in Toronto, and she is one of the consulting dermatologists for L'Oreal, and this is Dr. Julia Carroll. So you probably have seen her. You've been on a bunch of morning shows in Toronto, right?
Yeah. Morning shows, Marilyn Dennis, E.T. Canada.
That's awesome. That's so good. So guys, stay tuned because we're going to be doing a giveaway at the end of this video. I just want to let you guys know that off the bat to 3 viewers. So start sending in your questions right now. We're going to be talking skincare questions like hyperpigmentation, dullness, sunspots, all sorts of stuff like that.
Great.
Yeah. And also, so basically what we're going to be centering this around is this brand new line that L'Oreal just launched. It's called the Bright Reveal. And it's something that I'm testing out for the next few weeks. Because I do have a lot of sunspots, like I have they look like really well placed sunspots, like freckles. So I haven't been concerned up until now because now they're everywhere and they're super dark. So I need to tackle this. So I'm super excited to give this a try.
Fantastic. Yeah, this is a great line because it has 2 ingredients that are real heroes in the hyperpigmentation world. So it has glycolic acid, which we'll probably go back to because it's great for hyperpigmentation, it's great for acne, and it also works really well for dull, tired-looking skin. Safe in skin of color, though, so that's a really important feature. And then retinol, which is sort of the dermatologists, for the past 50 years, we've been touting the benefits of retinol.
Yeah, it seems to be like the holy grail. I hear about it everywhere.
Yeah. Besides sunscreen, I think it's one of the best anti-agers out there.
Yep. So do you want to talk to me about this for just a second? I know that this product over here, there's 2 steps, right? There's a morning and then there's a night.
Yes, there is.
So, and then this one here has 2 different barrels. So what's that all about?
Yeah, so this is really interesting. So, as a dermatologist, one of the things we are is experts at ingredients.
Okay.
And so, but it's really important, some people sort of concoct their own things, mix things together. Yeah. And one of the things you don't realize is that certain ingredients, if you put them together, they cancel each other out. So in this instance, vitamin C and retinol is in this product.
Okay.
But it's in 2 different barrels because if you mixed it together and then put it on the shelf, you wouldn't get the active ingredients would not be active anymore.
Oh, okay.
So in this way, it comes out. It's really interesting packaging. It comes out. I don't know if you can see that or not. But as a clear stripe and a white stripe, and then you mix it together, and then the active ingredients will still work. But if you did that in a bottle and left it on the shelf, they wouldn't be active.
They wouldn't work together.
No,
and what
so
about the
really
peel
cool
pads?
packaging.
Because that's really cool. Because I always hear about people that I've talked to before that have had skin issues in terms of texture and stuff like that. They'll usually go and get this massive peel done where their skin is flaking off and stuff like that. Is this like that, or what's it like?
I mean, this is kind of what I was saying. You can call this having your dermatologist in your makeup bag.
Oh, cool.
Right? So this is 10% glycolic acid. In the office, we may go as high as 70% glycolic acid, but this is something you can do on a daily or weekly basis, and you'll achieve similar results. And you'll get brighter skin.
It's safer for you.
Yeah, it's safer, and it's something that's accessible for people, right? Not everyone can afford to go to the dermatologist. Not everybody wants the downtime that would come with a mild to moderate peel.
Right.
So this is a great way to get similar results over time.
Awesome. Okay, I'm super excited to try this out. And I'll be posting a video with the results in a few weeks, so guys, watch out for that. Okay, so we're going to get into questions. I have a couple of questions of my own, first of all. Let me get into that. Skin dullness. So one of the things that I hear a lot of people talk about, and that I find too, is that sometimes you don't want to wear foundation. Mm-hmm. You want to go out and you want your skin to be super radiant. What can you do for your skin that will make it look as bright and just beautiful as if,
So one of the things that makes
10 hours of sleep.
Don't we all wish we could have 10 hours of sleep? One of the things that makes skin look dull or makes you look tired is if you have pigmentation on the skin or fine lines and wrinkles, and it's all about light. So the reason why, if you look at a teenager or a young baby, their skin glows because they have no marks or anything on their face. The sun or the light hits their face and it bounces off.
Right.
And then as we age, we get red spots, brown spots, lines, and the light gets trapped in those areas.
Okay.
So what you really want to do is decrease the pigmentation and the marks that are on the face, and then also improve the texture of the face so that the light's not getting trapped. So glycolic acid, again, is one of the great products for that because it will decrease pigmentation and prevent some of the pigmentation from lying down, and then it also improves the texture. And if you want to be more aggressive about it, certainly you've got lasers that we can do, and that's something that I often will tell patients. It's like airbrushing your face, right? So you really just want to get that no makeup look, and part of that just is about decreasing the pigmentation on the face.
I like that. That's a good explanation. Okay, I have a bunch of questions that you guys have sent in to me, so let's start with that. Well, this is kind of in the same vein that we just talked about, but how can you eliminate scars without makeup?
Okay, so scars from acne, did I say?
No, it doesn't. It doesn't say.
So I think you want to exfoliate the face. So using a product with glycolic acid will loosen up the skin cells that are on the surface, especially if it's a fresher scar. So if it's a scar that you've had for 30 years, probably it's not going to be that helpful there. And there you're going to turn again to our lasers. But if it's a relatively new scar, you want to protect it from the sun. So use a sunscreen every day so it doesn't become more of a permanent mark. And then, especially people, probably it's regarding acne. I think that's the most common place. People get a lot of scarring along the chin area, especially if you're a picker. And so using the glycolic acid peels are great for that because they'll treat the acne and they'll also lift over the scar and they'll keep the skin cells turning over much quicker. And then that scar should sort of filter out.
What age does the turnover start to slow down?
Probably in your 30s, you start to see it, and then definitely in the late 40s and 50s, there's a significant increase in that the length of time that the skin takes to get from the bottom of the skin to the top, called the stratum corneum.
Yeah, because I noticed that. So when I was younger, I would okay, this sounds super bad, and I know I'm in makeup and this is gonna be really bad, but sometimes I go to sleep with my makeup on. I know that we're not supposed to do it.
When you're young, you get away with everything.
But now, I mean, I just, like most of you guys know, I just celebrated my 40th birthday, and now I'm starting to see that, I better wash my face off because I can start to see lines and I can start to see texture. And if I put the moisturizer on, then I'm okay.
Right.
And take care of it. But if I kind of let that time go,
it's so key at night to get those layers off because you've got makeup, bacteria is trapped in there, and then pollution, and all of that can cause something called free radicals.
Right.
And free radicals kind of bounce around in the skin, and they can ultimately damage the DNA that's in the skin. So one of the ways you can fight that actually is obviously washing the face, but then using something that has a vitamin C in it. The vitamin C will actually bond with the free radical, and then your body eliminates it. So you can kind of stop the damage before it really sets in.
So you should ingest it and also put it on your skin.
Well, for me, mostly just put it on your skin. Ingesting it is not going to get it probably up to your skin.
You probably need massive doses.
Yeah.
Eat 20 oranges or something.
That wouldn't even work.
Okay, tips on reducing pore size.
So reducing pore size, one of the things to realize is that pores really, they're not doors, they don't open and close, so sometimes it's just kind of the way that you are, right? It might be genetic to some extent. I think things that can make pore size look worse is if you have bad makeup, you use a lot of self-tanner, it can get trapped in that area. Right. So using a scrub is a great way to sort of freshen those pores, and because they're sort of like these little holes, right? And if you've got dirt and sebum and makeup trapped in them, then it will make them appear larger.
Right.
So using a good scrub will get some of that sebum out, and then they appear smaller. And glycolic acid itself, again, because you're sort of taking off the top layers of the skin, it will shrink down the appearance of the size of the pores.
So glycolic acid is the way to go.
It's the hero.
Sounds like. All right, so let's just take a look here. So I had a question down here. So Holly wants to know about a good night regimen. She needs all the help and advice that she can get, basically.
Okay. So first things first is you have to wash that face at night. So in desperate times, I'm okay if you use a cleansing cloth. If you really are just going to crawl into your bed and not do anything, at least try to get some of the day off, so get the makeup off, get the oil, get the dirt off. Okay. And then the next thing is choose kind of what's your focus? What are you trying to improve, or what are you trying to get rid of? And that may change from month to month, day to day. This is where you're going to do your targeted ingredients. So whether it's an antioxidant with a retinol, is it a glycolic acid? Are you trying to treat acne? That's where your treatment goes in at that point. Okay. And then you're going to finish off with a moisturizer. Now, you may be lucky enough to find all that together in one product, but the big thing is get all the makeup off, put active ingredients on, and then moisturize the skin.
Okay, perfect. Awesome. Also, Haley says, I have dehydrated skin with glycolic acid. Will glycolic acid dry it out more?
Well, it's kind of interesting because glycolic acid, one of the things that it does is if you have a lot of dry skin, sometimes your moisturizers are not getting in because you've got these layers and layers of dry skin.
Right.
So using a mild glycolic acid will actually loosen up the dry skin so it lifts off, and then your moisturizer is able to get in there and do a better job. Having said that, if you find you're using glycolic acid and you're getting more and more dry, you may want to take a little break, moisturize well, and then slowly go back at using a retinol or a glycolic acid.
Okay, perfect. Okay, what is a good skincare routine for 40 and over?
So I think if we're 40 and over, you know, when I think about the routine, it's pretty basic still. I think you always want to make sure you're washing that face, ideally twice a day. You want to look for some active ingredients, so when you're going to use in the morning and when you're going to use at night. I love antioxidants. I love retinols and glycolic acids. Those really are my go-to. It's sort of repetitive, but that's kind of my trifecta, as I always say: sunscreen, retinol, and some type of antioxidant. Those three together. And if retinol is too much for you, you can use a glycolic acid instead, or if you can handle it, you can use both together. You just kind of think in those categories and then find the products that fit your budget and fit your skin type.
Perfect. Okay. Okay, we talked about brightening. Okay, just say, so the question is about going out and spending hours in the sun without sunscreen. What do you do to salvage your skin?
So, first of all, shame. Don't do that. So, I mean, if you find yourself, you know, out and you don't have sunscreen, first of all, sunscreen is the third line of protection, right? So, find cover, go indoors, you know, put your hood up, whatever you can do to get yourself out of the sun. You know, I get the phone calls all the time from, you know, someone who's in Florida, or, you know, they've gone away on holidays, and usually it's the mom and she's been really good about lathering up her kids, and then she forgets her chest or something, and I get a desperate phone call going, oh, what do I do? And so what I always tell people is go for that antioxidant, because that's when the damage is happening, right then and there, when your skin is red and inflamed. So if you get some antioxidant, it will decrease that inflammation, and it'll start to repair some of that sun damage, and then just fingers crossed that you don't have any long-term damage.
Fingers crossed. Guys, keep sending in your questions. I'm going to keep going here with the other questions I have. What is okay, so we have something for teens. What is the best way to treat acne on preteens?
On preteens, so, you know, you want to look for a combination of ingredients. Probably two of the best ones would be benzoyl peroxide and salicylic acid, and that's available in lots of over-the-counter products. If you have a lot of pigmentation that's resulting from the acne, then the glycolic acid would be a good thing to add in as well. Don't do too much at one time, and, you know, just try to keep it simple for the teenagers, because often they're just starting and you don't want to overwhelm them with products. So good face wash, and then either a spot treatment or an all-over gel that has salicylic acid or benzoyl peroxide in it will be a good place to start.
Okay, perfect.
And don't pick.
Okay, this is the funniest question ever.
Okay.
Okay, it's kind of long, so give me 1 second. Let's say that you are tired from lack of sleep due to everyday stressors of work, family life, unbalance. Your eyes just want to shut. What skincare regimen can you use to waken you up and brighten your face up so people don't ask, are you sick, because you look sick?
Oh gosh, as a mom of a 6-year-old, I can relate to this. So I think, again, having, you know, if you can wash your face once a day for me, then I'm happy.
Okay.
You know, if you can get some cleansing wipes sort of on the side, these glycolic acid pads would be great for someone like that, because it's really quick. You can put it on, it gets the active ingredient on, it's going to wipe off a little bit of the extra makeup, and it really does brighten the skin over time. You can feel it right away when you use it. It tingles a little bit. It's just like a mini peel.
I think what a lot of people, like with a lot of people, they don't take proper care of their skin. They don't put the effort in morning and night to make sure that they are in that regimen. And then they just throw foundation over top to touch.
For sure. And then that makes it worse.
Yeah. So it's like you have to if you just stick to it and just keep doing it, your skin will look.
One of the things to do is just get your products in the order that you use them, sort of morning and night, and just have it out on the counter so that when you go to bed and you're brushing your teeth, they're staring right at you, and it's just going to take you 2 more minutes to do it. And then you just have that routine. I find, like, if it's hidden behind the medicine cabinet or it's in a drawer, you know, you always leave yourself last.
That's
right?
true, yeah.
So just putting it out there by your toothbrush, so it's something you remember to do.
Perfect. Okay. Let's see. Oh, this is actually one of my questions too. Can we talk about getting rid of blackheads and whiteheads?
Okay.
Yes.
So blackheads, you know, retinols and prescription retin A are helpful for getting rid of blackheads. Okay. I think in a pinch, if you're really obsessed, those pore strips are not the worst thing in the world to use. They do.
I was wondered about that.
Yeah, it's temporary, but they do get them out. Some of the cleansing brushes are helpful to loosen things up. The glycolic acid products, again, are helpful because they separate, like the skin cells are sticky, and that's what makes a blackhead. And glycolic acid will sort of undo the glue that holds skin cells together, so it'll make it easier to then use maybe an exfoliator to pull that out.
Okay.
In terms of whiteheads, you know, I think if someone's to the point where they're using whiteheads, you're going to look again for like the acne ingredients, which are benzoyl peroxide and salicylic acid. But if you have a lot of painful cysts and whiteheads, it really is important to get to your doctor because it can leave a lot of long-term damage, and it's really hard to fix acne scarring. So I like to get on top of that as soon as I can.
So like, what about like, I mean, you're sitting right beside me. You guys probably can't see this at home unless you've seen my YouTube videos.
I can't see anything either.
But like I have like these ones here and like little guys.
Those are milia.
Oh, what is
those
that?
little white ones? Those are milia.
I've never even heard of
So
that.
they're basically like little tiny cysts. So instead of being under the skin, they're in the epidermis of the skin.
Okay.
And it can be genetic. And it can also be from using products that are too rich. So if you have them around your eyes and you maybe just started using a new eye product, then you may find that you start to get these little collections of cysts around the eyes. And they're just deep enough under the skin that you probably have tried and you can't get them out.
Yeah, no, I can't. It's really annoying.
Yeah, so you
have to wait.
If you have a really good esthetician, they can get them out, or you can see the dermatologist, and we'll actually go in and pull them all out. And then you want to, you know, be a bit more aggressive about exfoliating. So, you know, whether you're using an exfoliating rub or an acid pad, those things will all help. But sometimes it's just genetic, and every once in a while you might just have to see your dermatologist and get them out.
So with these two products, you want to avoid the eye area, right?
With caution,
maybe the edge,
you could use, I mean, where yours are, like for me, the eye is like right here.
Oh, okay.
Down here, I'm okay.
You're okay? Okay.
Yeah.
All right, perfect. How to keep the face hydrated, especially in winter?
Well, it's basically using, you know, a good moisturizer, but it also starts with protecting your skin. So making sure you've got a humidifier in your bedroom, because that's where hopefully you're spending a good amount of time sleeping. So that's a good way to hydrate the skin. You know, protect your skin when you're outside. If you're outside in the dead of winter in Canada, you want to have some kind of protection, whether it's a scarf or a nice hood on, because that moisture just gets drawn out in the Canadian winters. And then it's just a matter of finding good, like, you know, upping your moisturizer game and staying ahead of it. So start in the fall. Don't get dry skin and then try to repair it. Stay ahead of it.
Okay, perfect. Thank you so much. So that's all the questions I have for you. So stay tuned, guys. I'll be posting the winners in a little bit. And there's one more thing that I wanted to say. So the video will be up so you guys can watch it later on. So if you missed it, don't worry. You guys can watch it. And thank you so much.
Thanks for having me.